Thank you for joining me today. In this video, you will learn more about cultural competency, diversity, and inclusion care. Cultural competency, diversity, and inclusive care. So, cultural influence, belief about the illness. Culture influences a belief about the illness, especially mental health. It influences help-seeking behavior. It influences the treatment acceptance. The goal of cultural competency is a respectful and patient-centered. Cultural and mental health. Culture shapes the view of mental health, spiritual or medical. Stigma level. So culture shapes how people view mental health. Some people think it's a spiritual, some people think it's a medical. That's why the mental health, there's something wrong with spiritual or mental health. Some cultures may believe that. There is a stigma level. Some of cultural can shape the stigma level. Cultural can shape use of a traditional or Western treatment. Some groups experience healthy disparity. Reduce access to the care. That reduces the access to care because of their experiences that they have with health care, or their culture shape how they view the treatment. Cultural influence care. Cultural influence on care affects the communication style. It affects decision making. It affects family involvement. It affects the treatment adhesiveness. Some cultures rely healers. Some cultures rely on healers on family decision making instead of individual freedom or individual independence. So some cultures, they make their decision together as a family. Some cultures, person make their own decision independently, and then the family support that or may not support that, but it's an individual decision, or it is or family decision. So some cultures, they make family make the decision together for the patient. Some cultures, the individual is independent for their decision, so the family don't even try to make decisions. They just sit there to support the patient and see what they decide. Cultural competency. So as a provider, you want to have that cultural competency, which is the ability to promote care that is respectful to the culture and beliefs of the patient and the family, adapted to the patient preference, because the treatment is for the patient. The element of a cultural competency include awareness of your own bias as a provider, cultural knowledge, knowing the culture of the patient, cultural skills to assess what is happening or what the patient wants based on their culture, cultural encounters, cultural assessment. Cultural assessment include beliefs about the illness. You want to assess that. Prefer treatments. You want to know the preferable treatment that the family or the patient will like. You want to assess their language needs. If they don't speak the same language as you or same as the provider, or the language that you want to do the treatment for. You want to have that either translated to their language or have somebody who knows the language. You want to conduct the treatment for their language that they understand. Family role. You want to understand the family role of taking care of their loved ones. Spiritual belief. What are their spiritual beliefs for healing and treatment and mental health? You want to use open-ended questions. What do you think caused your illness? You don't want to have bias or judgment. You want to listen to the family and the patient. Cultural humanity is very important and is lifelong about the culture. You want to recognizing you don't know everything. Letting the patient guide your care. More important than knowing everything about all cultures. It's more important than knowing everything about all the cultures. You can't know all the cultures, but you want to involve with the family and the patient and the community that they come from. What do they need? How do they deal with the patient? How do they treat the patient? What kind of treatment do they would like to see? You want to avoid bias and stereotype. Implicit bias is unconscious attitude, leads to inadequate care. This misdiagnosis, poor outcome. So bias and stereotype, you cannot treat patient when you have bias and treatment. And you have to be aware of that on yourself as a provider. As a provider, you must identify the bias that you have. Practice a self-reflection. Diversity, equality, and inclusion. Diversity is differences, different culture, color, race, gender. Equality is a fair access to care. Inclusion is a respectful environment. That is inclusion. You want to create respectful environment. You want to help the patient and the family to have fair access to care. You want to have a diverse interprofessional care that will involve. The goal of diversity, equality, and inclusion is to eliminate disparity in health care delivery. Healthcare disparities. What are the healthcare disparities? Healthcare disparity is a differences in outcome due to socioeconomic status, race and ethnic and geographic setting. So healthy disparity is when people have different outcomes due to socioeconomic status. That means if you are poor, you are not going to get the same treatment as somebody who is rich or come from privilege. It is, you will have a different outcome from different race. You will have a different outcome, or you will get different treatment outcome if you live maybe rural area, maybe disadvantaged area or town that don't have a provider or don't have the treatment that you need. Some of the rural area, they may not have mental health setting. Some of the rural area might not have everything that the patient needs. So example of limitation will be limit access to mental health services. So that area, they have a limit access to mental health services, like a rural area, like urban that don't have primary care. Let's say you want to discharge the patient from the hospital and they want to be with their family, but there is no close mental health outpatient and they cannot drive, or maybe the family cannot drive. They could be living in rural area and it's hard for them to drive to the big city or where they can find the access to mental health services. Misdiagnosis in a minority population. Happiness. Differences in treatment outcome happiness when there is a bias or stereotypes. So there is a 6 cultural phenomenal. There's a 6 cultural type of phenomenal, which is communication space. People communicate differently. There is a space. Some people like to be close, proximity, give hugs. Some people like to have a space and they don't want to be close to each other based on their culture. Social organization is different from group to group. Time. Some people follow the time to the teeth. Some people, they don't follow the time. They just come there when they can. Environmental control. Biological variation. People different from their biological different is different. So use to assess the cultural difference. You want to assess the cultural differences and how that affected the patient care or how you can accommodate their differences. As a provider, you want to provide cultural sensitivity care, adaptive communication style. You want to advocate for underserved population. You want to advocate for underserved population. You want to address the social determinant of health. Cultural competency care strategy. So how you can improve cultural competent care? What is the strategy? The strategy is use interpreter service, somebody who speaks the language. You want to respect the traditional practice. You want to avoid assumption. You want to provide individual care. Those are the strategy you want to use to overcome the barriers. What are the barriers of providing a cultural care? Language differences can be barrier to provide a cultural care. Mistrust of a healthcare system is the barrier. Stigma is a barrier. Provider bias is the barrier for providing cultural care. Cultural affect all aspects of a care. Cultural humility is greater than or more important than the cultural competency. So cultural humility is important. Always perform a cultural assessment. Avoid stereotyping. Use interpretation, not the family. You want to use interpreter services. Address healthcare disparity. Cultural care. Cultural care include communication. You want to have a better communication, understanding of the culture and beliefs. Language need. You want to understand the patient need language. Traditional. You want to understand the tradition and or know there is a tradition, that they have the tradition. You want to assist unconscious bias. You want to respect the differences. You want to have a equality of care. You want to have encourage and have cultural humility. You want to assist the cultural needs. You want to provide resources to help them, help the patient. You want to encourage engagement. Because the effective psychiatric care requires respecting cultural differences, reducing the bias, delivering equitable care, and providing patient-centered care. Thank you for joining me today. I would love to see you in my next video, and please subscribe if you learn anything from this video. Thank you.